Hi everyone, and welcome back to the Stanford IR video lecture series. We're going to move on to discuss common equipment used in IR. We'll go ahead and start with needles. So needles are one of the basic things used by an interventional radiologist. Common uses for needles include accessing various areas of the body, such as the arterial or venous system, or even organs, such as the collecting system of the kidney or the inside of the stomach. They are also used for biopsies, and you can inject or aspirate through a needle. Needles are measured in gauge, which measures the outer diameter of the needle. Gauge is somewhat counterintuitive in that a needle with a lower diameter will have a higher gauge than a needle with a larger diameter. We'll discuss this in more detail. So this is an example of two needles. On the top, you'll see an 18 gauge blunted beveled tip needle. The blunted part means that the end of the needle is not sharp, and the beveled part means that the end is at a slight angle, and you can see that as circled by the red circle. Under that is a 22 gauge needle. So you'll see the gauge is higher than the other one, which means that the diameter is actually smaller, and you can see that this is a smaller needle. This needle also has a sharp edge, because the end of it is sharp, but it is also beveled in that it is slightly angled. Examples of other needles include those such as a 22 or 21 gauge needles. These are somewhat smaller and can be used to access small targets such as a small abscess, a renal calyx, and the arterial system. And then there are larger needles such as an 18 gauge, which can be used for larger targets such as a large abscess or a biopsy. So here is an example of other needles with a slide taken from a radiographics article. As you can see, needles with a different gauge have different coloring schemes. I wouldn't memorize this coloring scheme because it can vary by institution. An example of other needles such as seen here is the 21 gauge needle in the middle, which is in green. This is a micropuncture needle, and this is the needle often used at the beginning of arterial procedures to gain access to the arterial system. An example would be a transarterial chemoembolization. All the way to the right is a blue hubbed needle, and this is a 25 gauge needle. It has a very small diameter because it's 25 gauge and is often used to inject lidocaine because it does not cause a lot of pain. The 20 and 22 gauge needles demonstrate what a needle looks like when it has a safety mechanism, and I'll show a short video on how to use that. And then on the bottom, you can see that needles with the same gauge can have different lengths.
So if you remember, we said there's some needles that have a safety mechanism already on them. This is one of them. So you'll see the safety mechanism here. If you release it like that, and then push down, it'll cover up the needle, and now there's no more sharp end here, and this needle is now considered safe.
Other than being broken up by gauge and length of needle, they can also be divided into two different types of needles, such as a single wall and a trocar style needle system. Starting with the single wall needle system, an example can be seen on the right top image. So this is a hollow core needle, and it has a beveled edge. You can attach different syringes and devices to the end, and then aspirate or inject different material through the needle. On the bottom right is an example of a trocar system. This is a two-part system where there's an outer cannula, which can have a blunt tip, and then there's an inner sharp three-sided trocar needle that goes through the cannula. For example, on the picture on the bottom right, there's a small red arrow. Here you can see the interface between the blunt cannula, and then through that is the sharp three-sided trocar needle. On the bottom of that is a red circle. So if you twist this part of the system and pull backwards, you'll actually pull out the sharp three-sided trocar needle, and then just the blunt outer cannula will remain in place. We're going to go ahead and move on to catheters now. So the most basic definition of a catheter is a tube with a hollow lumen which can be used for various diagnostic and therapeutic purposes. Examples of catheter use include maintaining access, You can inject various materials through a catheter. You can aspirate fluid or various substances through the catheter. You can deliver embolic material to various organs in the body through a catheter. It can be used to balloon or stent open vessels, and it can also be used for retrieving or deploying devices such as IVC filters. Catheters are measured in French, and 1 French is 1/3 of a millimeter and 0.013 inches. So if you have something that's 5 French, if you divide that by 3, it'll give you the millimeters. And the most important thing to remember about a catheter is that the French size is the external diameter of that catheter. And this will become more important as we start to discuss sheaths. So this picture is an example of a catheter presented in a radiographics article. And as you can see in this catheter, it's a pigtail catheter and it has multiple side holes. And it's a type of non-selective catheter which can be placed into the aorta or the venous system, and then contrast can be injected through this to opacify the system that you're in.
So this is an example of an omni-flush catheter. As you can see on this end, this is where you can insert a syringe or connector tubing or whatever you're going to hook this up to. And on this end is the actual end of the catheter. So this is the curve for an omni-flush, and you can see these little side holes are where the contrast will come out when you're injecting.
So at the most basic level, catheters can be divided by 3 different types. The first division is whether the catheter has an end hole or whether it has multiple side holes. If it has multiple side holes, then whatever is injected through the catheter, such as contrast, will exit all of these side holes. Secondly, they can be categorized as selective versus non-selective. Non-selective catheters are typically placed into large vascular structures such as the aorta or the IVC, and then contrast can be injected through them to opacify those vessels for a diagnostic aortogram or venogram. Selective catheters are typically designed to enter certain vessels, such as the renal arteries or the vertebral arteries. Then catheters can also be categorized by their diameter and their shape. And then diameter is the size in French, and the shape is obviously the shape that the catheter takes at its most distal end. So this is another slide taken from that radiographics article. I just want to show you a couple more catheters, but do not feel that this should be memorized because there are lots of catheters out there and you will really start to learn about them as you use them. On the top is an example of a glide cath. This is a very commonly used hydrophilic catheter that can have many different tip types. Below that is a Simmons catheter. As you can see, it has a reverse curve, so it'll start to curve one way, simulating a U-turn, and then it'll start to curve the other way. Below that is an example of a microcatheter, and a microcatheter is an even smaller catheter which can be inserted through a regular catheter to select smaller arteries. This is an example of a 3 French microcatheter. As you continue on your journey in IR, you're going to develop a lot of skills. But as you are beginning, there's a couple important things to keep in mind about catheters. You always want to flush a catheter before and after its use, because while they're being used, they can develop debris or thrombus inside them, and you don't want to insert this back into the patient. In general, you also want to advance a catheter over a wire. There are going to be exceptions to this depending on what you are doing, but this is in general the safest way of advancing the catheter through vasculature. In addition, you don't want to bend or fold catheters because they can maintain the bend or fold that you've placed to it and then not return to their original state. Now that we've discussed needles and catheters, we're going to move on to wires. Wires have a variety of purposes, and 2 of the most common are maintaining access and guiding catheters. If you remember, needles are measured in gauge Catheters are measured in French, but wires are measured in inches. Two of the most common wire sizes are 0.018 and 0.035 inches. Two important sets of numbers to remember are that you need at least a 22 gauge needle or 3 French catheter for a 0.018 inch wire, and you need an 18 gauge needle or 5 French catheter for a 0.035 inch wire. Now, you'll notice a concept we talked about before. You'll need a bigger French catheter to accommodate a bigger wire, but you'll actually need a smaller gauge needle to accommodate a larger wire. This is because the smaller the gauge of a needle, the larger the lumen. I know this can seem a little bit confusing, and I'll have a video demonstration at the end of how these systems work together. So I wanted to include this diagram for the Terumo website to demonstrate what a wire is actually made of. If you just look at a wire on the surface, like I did when I was a first year, I thought that it was basically just one component. But there are some wires, such as this guide wire, which actually have multiple components. To keep things very simple, you'll notice that the innermost part has a core wire. This is sometimes called a mandrel. And then around that, you can have a wire which is coiled. And this adds various properties to the overall guide wire. And then around that wire, which is coiled, there are different types of coatings that can give the wire different properties. Again, this is a very basic review, and you can look up the specific features of the different types of wires we use. So wires at the most fundamental level can be divided into 3 different categories. The first describes the diameter of the wire, which is the size. The second describes the stiffness of the wire, which is basically how floppy or stiff the wire is. And the third important category is whether the wire is hydrophobic or hydrophilic. Hydrophobic wires in general can be used when they're dry or wet, and these wires are potentially more steerable, but they may face more resistance in a fluid environment. Hydrophilic wires can in general pass through more tortuous and narrow areas because they face less resistance, especially in a fluid environment. But these wires need to be kept very wet or they will become sticky and difficult to use. Additionally, wires can be divided into 3 different types for general discussion. One type of wire is an access wire, which is typically a wire that is used to gain access into a vessel. A second type of wire is a maneuver wire, and these wires are typically used to navigate a path or select specific vessels. These are typically hydrophilic and less stiff. A third type of wire is a rail wire, and this can be used to facilitate ballooning, stenting, exchanging various catheters, or placing materials such as tubes or lines. This is another diagram from the radiographics article, and again, it is not meant to be memorized. I included this diagram just to demonstrate that there are many different types of wires for different purposes. If you look all the way on the left, they're divided into 2 rows. The top are wires that are 0.018 inch, and the bottom are wires that are 0.035 inch. In addition to that, they are divided into 2 columns, which is hydrophobic and hydrophilic on the left. And then each of these categories has wires with different levels of stiffness, which determines how floppy the wire is. If you'd like, you can pause here and take a look at the different names. Some very commonly used wires include those all the way in the upper right, or the cope wire, which is used to gain initial access into a vessel. Another very commonly used wire on the bottom left is the glide wire, which is typically used to navigate through vessels. And then another commonly used wire on the bottom right, second to last, is the Amplats wire. And this is a stiffer, hydrophobic wire which can help with exchanging various catheters, tubes, or lines. An additional device that is helpful to discuss in the general realm of wires is a torque device. So some wires, such as a glide wire, can become very slippery when wet, and in that case a torque device can be inserted on the wire and screwed in place so that you can grip the wire better, and it increases the maneuverability of the wire in your hands. I'll demonstrate a video of the torque device.
So this is a torque device. So one end goes here, and then the front end is here. And this is typically used on something like a glide wire. So you put this over the glide wire, and then that will tighten it. And now you have control of your wire. So if your wire is going into a catheter, you can move it in, and you can turn it very easily if the wire is slippery. So you almost always want to load that onto a glide wire if you're loading up a glide wire for someone.
So the final tool we'll discuss in this lecture is a sheath. So a sheath allows the interventional radiologist to maintain access into the arterial or venous system. You may be wondering, what's the point of a sheath if we can just put a catheter in the artery and do things through a catheter? But if you imagine, a catheter has a hole on both ends. So if you put a catheter through the artery, there's nothing to stop the blood from flowing through the artery into one end of the catheter and continually flowing out of the catheter and therefore out of the patient. So what a sheath does is that it takes the place of a catheter and it has a one-way valve so that other catheters or wires can be inserted into the sheath and therefore used for intervention, but blood cannot flow out of the sheath and the patient will not exsanguinate. I'll demonstrate a video to show how this works. Now a sheath is also measured in French, and if you remember, 1 French is 1/3 of a millimeter. However, the French of a sheath measures the internal diameter. Therefore, a 6 French sheath can accommodate a 6 French catheter because the outer diameter of the catheter is 6 French. So this is an example of a sheath on the bottom, and then the other object on top is a dilator, which is inserted through the sheath. So if we pick up this sheath and look at this end, this is the end outside of the patient. And you can see it has a covering. So this is a one-way valve. So other tools such as smaller catheters and wires can be inserted through this, but blood cannot flow backwards outside of the patient. So you'll notice that attached to this sheath is tubing. You can attach various syringes to this tubing and inject different materials such as contrast. If contrast is injected through there, it will flow out of the sheath and opacify the vessel it is in. Additionally, you can hook up a saline flush, which will flow inside there and it'll flow down into the sheath, and then the saline will be dripped through the sheath. This is done because if you imagine a smaller catheter through this sheath, there will be a space between the smaller catheter and the larger sheath. And in this space, the dripped saline will flow so that thrombus does not form. Whenever you hook something up to this tubing, make sure you turn the off switch superiorly so that the injected material can actually flow.
This is a dilator, and the way this works is when you're inserting this sheath, you can see the end of the dilator is nice and tapered. It doesn't end abruptly like the sheath does. And basically the dilator goes through here into the sheath, and now you'll see once the dilator is in, now the end of the sheath is nice and tapered, and this you can enter over a wire into a patient's vessels and it won't traumatize them when it has a nice and tapered end. And then once this is in, you would essentially remove this dilator and then you can hook it up to a saline flush, and then you can enter other catheters and wires through here for your intervention.
As you become more skilled in IR, you'll learn to do many things with a sheath. But as a beginning interventional radiologist, an important principle to remember is that you should not advance the sheath without the inner dilator inserted, because the end of the sheath without the dilator is blunt and not tapered, and you can cause dissection and injury to vessels. All right, now I'm going to do a real brief video demonstrating the diameter and sizes of a sheath, wire, and needle, and how these are used to your advantage.
So these three tools are from a micropuncture set. This is a 21 gauge micropuncture needle. This is a 5 French catheter. And there's an end hole here where wires can go through this. This is a 0.018 inch wire, and this is a 0.035 inch wire. So you'll see if you try to put a 0.035 inch wire through a 21 gauge needle, it won't go in. So if you have access into the arterial system with this needle and you try to get this wire into the artery to do various interventions, it won't work, right? So what would you do in this case? So you have your arterial access here. You take a 0.018 inch wire. That can go through a 21 gauge needle. So you get that through. Now the wire is in the artery here. So you maintain that access. You can pull the needle out over the wire. So now you still have access here in the arterial system. Then you take this 5 French catheter, which can fit over this needle, over this wire. You thread this through the wire, and then you get this into the arterial system. So now you have a 5 French catheter, and through that a 0.035 inch wire can go. So you take out the inner, so here you're still in the arterial system now with a 5 French catheter. You take this out, and now you can take that 0.35 inch wire and you can get that into your 5 French catheter, and you can get that through. So that's an example of a common exchange where you puncture the arterial system with something which is 21 gauge and can't necessarily fit a 0.035 inch wire, and you exchange up to a 5 French catheter, and now you can get this wire in there.
All right, everyone, thanks for making it to the end of this video. I really hope that this helps you feel more comfortable with the common equipment we use in IR. I remember a lot of this stuff was kind of confusing to me when I was a medical student and first-year resident, so I hope that this demystifies the tools we use.